Welcome back viewers. In today's video, we are going to discuss about the clavipectoral fascia. So, what is this clavipectoral fascia? You know, the deep fascia in different regions is given a different name. So, similarly, the deep fascia which is present in between the pectoralis minor and the subclavius muscle is given the name as clavipectoral fascia. It extends from the clavicle to the pectoralis minor. So the deep fascia which is present over there, it is thickened to form this clavipectoral fascia. Okay. So this is nothing but the deep fascia. We will just have a look at the attachments of the clavipectoral fascia. So as I told you, if we have to trace the clavipectoral fascia, it is attached to the lower surface of the middle third of the clavicle. So if you have a look at the clavicle, the under surface of the middle 2/3 of the clavicle will have a subclavian groove and it will have two lips. So the two lips will give attachment to this clavipectoral fascia. Okay, so it is attached to the clavicle and it encloses this muscle, which is nothing but the subclavius muscle, which is present in the under surface of the clavicle. So after it encloses the subclavius muscle, it will extend up to the upper border of pectoralis minor muscle. So this is the pectoralis minor muscle. So at the upper border of this pectoralis minor, this clavipectoral fascia will again split to enclose this pectoralis minor muscle. Okay, and then it will continue downwards as the suspensory ligament of the axilla. So this suspensory ligament of the axilla, it will help to maintain the dome of the axilla. It will help to maintain the dome of the axilla. This suspensory ligament of axilla will get attached to the axillary fascia and it will help to maintain the dome of the axilla. So if we trace it from above downwards, superiorly it is attached to the clavicle, middle 1/3 of the clavicle, then it will enclose the subclavius muscle. At the lower end of the subclavius muscle, the two layers will fuse and they will extend as a single layer up to the superior border of this pectoralis minor muscle. This is the pectoralis minor. Then again these will split to enclose this pectoralis minor. Then it will continue as the suspensory ligament of the axilla and it is attached to the axillary fascia and this helps to maintain the dome of the diaphragm. So this part which is extending between the clavicle and this pectoralis minor is what we are exactly referring to as the clavipectoral fascia. So the deep fascia which is present here in between this clavicle and the pectoralis minor is called as the clavipectoral fascia. Okay. So medially if you see this clavipectoral fascia will get continuous with the first and second intercostal spaces and laterally if you take it will get attached to the coracoid process. So on the lateral part, the part of the clavipectoral fascia which extends between the first rib and the coracoid process, it is thickened to form the costoclavicular ligament. Okay. So these are the attachments of this clavipectoral fascia. So this clavipectoral fascia, it is being pierced by few important structures. So what are those structures which are actually piercing this clavipectoral fascia, making it so important? So the structures piercing the clavipectoral fascia can be remembered by a mnemonic which is called as CALL. Okay, CALL. It is a mnemonic to remember the structures piercing the clavipectoral fascia. So what is the first one? C stands for cephalic vein. Cephalic vein. So you see here So this is the axillary vein and this is the cephalic vein. The cephalic vein pierces the clavipectoral fascia and it will end in the axillary vein. Next, what is the other A? This is acromiothoracic artery. Acromiothoracic artery. So, if you remember, the axillary artery, it has got three parts. The first part gives off the superior thoracic artery. Second part gives off this acromiothoracic artery and lateral thoracic artery. So, this is the branch from the second part of the axillary artery. So, the artery which is given off is called as acromiothoracic artery. So, that will pierce the clavipectoral fascia and it will finally divide into four branches. Okay. And what does this L stand for? First L will stand for lateral pectoral nerve. So, this is the lateral cord of brachial plexus. So, this will give off a branch which is called as lateral pectoral nerve, which will supply the pectoralis major muscle. This is the pectoralis major muscle. So, the lateral pectoral nerve is piercing the clavipectoral fascia and it is supplying the pectoralis major muscle. Now, what does the other L stand for in this cord? So, the other L will stand for the lymphatics. Which lymphatics? The lymphatics which drain the infraclavicular group of lymph nodes. From there, they will pierce this clavipectoral fascia and they will end in the apical group of axillary lymph nodes. Okay. So, the lymphatics from the infraclavicular group of lymph nodes and from the mammary gland, they will pierce this clavipectoral fascia and finally they will end in the apical group of axillary lymph nodes. So, these are the four structures which will pierce the clavipectoral fascia. Isn't it easy? Remember it like CALL, C-A-L-L. So, C is cephalic vein and A is for the acromiothoracic artery which arises from the second part of the axillary artery, and you've got the lateral pectoral nerve which arises from the lateral cord of the brachial plexus and it will supply the pectoralis major, and the lymphatics from the mammary gland and the infraclavicular group of lymph nodes which finally drain into the apical group of axillary lymph nodes. So, these are the four structures which pierce the clavipectoral fascia. So, in the dissection part, actually, if you want to have a look at this clavipectoral fascia, we actually have to remove this pectoralis major. In specific, once we remove the clavicular head of the pectoralis major, then we can immediately see the clavipectoral fascia. Okay, and then you can dissect all the structures which will pierce the clavipectoral fascia. So, this is in total about the clavipectoral fascia. Hope you all have understood. Thank you for watching.